For Session Update, I'm Shannon Lurkey. Governor Dayton proclaimed the week of April 18th to be Water Action Week at a recent press conference. The proposed initiatives seek to raise awareness of the water quality in the state's rivers, lakes, streams, and groundwater. Minnesotans are urged to follow a few simple actions, like learning about the water quality in your area, teaching your children about clean water and letting them teach you, and setting a water conservation goal. For example, turning off the water when brushing your teeth or taking shorter showers. Here's that press conference.
Today I'm issuing a proclamation proclaiming this week Water Action Week throughout Minnesota, and we'll be engaged in a variety of travels and events around the state to highlight the importance of water quality to the state of Minnesota. You know, we've done a lot in recent years to improve water quality, spend a lot of public resources, private resources, but in many parts of the state the quality of our water is deteriorating. And that tells me two things. It means, first of all, we're not doing enough to improve water quality, and secondly, we're doing too much to create greater problems. And that'll be the focus of this week, to make citizens all over Minnesota aware of their own water quality situation and ask them to take steps to engage with their public officials and make sure that their water is protected. I'm making 4 specific recommendations to citizens. One is to learn about your water quality. You can visit the Pollution Control Agency's Water Action Week webpage and learn more about the quality of water in your particular community. Ask your local officials. Have your well tested. Second, teach your children about clean water and let them teach you. A lot of the schools this week are going to be engaged in water quality lessons. I urge parents to talk with their children about the quality of water, ask the same questions. What can we do in our home to conserve water, use it more wisely, and then to be sure that the water that your children are drinking is clean and safe. Third is set a water conservation goal. Along the same lines, there's steps anybody can take. Turn off the faucet when you're brushing your teeth. Take shorter showers. Take showers, but take shorter showers. And take other steps that are small steps, but they add up collectively to a big difference for the quality and availability of water throughout the state. And fourth is call your legislators. You know, I have a number of initiatives in the operating budget and in the bonding bill for water quality, particularly the funding to help smaller communities around the state afford the cost of improving their water quality, making their drinking water safe for their citizens. I urge people to review my proposal on my website and to contact legislators and indicate their support. This is the beginning of what will be, starting on July 4th, a year of water quality action in Minnesota, a year of safe water action. And I'll be incorporating, as I travel around the state, my 87 counties in 86 days, which all of you are cordially invited. Starting later in the summer, I'll be incorporating water quality initiatives and events to highlight the areas where water quality needs to be improved and what we can do about that. But that's for the summer and fall. For now, this week is Water Action Week in Minnesota, and I wanted to ask, appreciate all the commissioners over here who have a role in this participate, and I'll ask a couple of them to speak just to highlight what they're doing. Commissioner Stein, Minnesota Pollution Control Agency.
Thanks, Governor. Good morning, and thank you, Governor, for kicking off this week of water. It's Earth Week, and since 71% of the Earth's surface is covered by water, it seems appropriate that we brand it as Water Week in Minnesota. We're an upstream headwaters state. 98% of the water that leaves Minnesota fell on our state. So we don't look upstream to almost anyone for our water quality. What we have is what we have made it to be. So that tells me that clean water is our responsibility. And you know, Minnesotans stood up in 2006 when they voted for the Clean Water Fund and for the legacy constitutional amendment that has provided funding for our agency to thoroughly investigate with science, with data, all of our state's water resources, our lakes, our rivers, our wetlands, and our groundwater. We need to know where we start before we can measure where we're going. And what have we learned? Well, we've learned there's some good news and some bad news. Our report, Swimmable, Fishable, Fixable, describes the challenges that we all face as Minnesotans. The words fishable and swimmable come right out of the Clean Water Act that the nation's Congress and President passed into law in 1972 that was worked on by then congressional staffer Jim Oberstar. The good news is 60% of Minnesota's watersheds are doing good. We have good water quality in those watersheds. They're mostly in north central Minnesota and northeastern Minnesota. 40% of our watersheds, however, are already polluted or impaired. What are they impaired by? Nutrients, things that come from our actions on the land, nitrates, phosphorus, for example, bacteria that come from grazing in watercourses and from our wastewater discharges, sediment that come from altering our landscape and moving water quickly through the systems that move water across our land and destabilize our streams. And then persistent and accumulating compounds like chloride and mercury, some of them naturally occurring, but some that have come as a result of human activity. So you might ask, how did we get here? Our waters got this way over a long period of time by many individual actions that all added up. And how do we get to clean water? By taking individual actions that will similarly all add up. And we know this can pay off. In Minnesota, we have had 35 formerly impaired waters that have been fully restored to Clean Water Bill of Health over the last 10 years. More are heading in the right direction. Some of those lakes that have been restored, Fulda Lakes in Fulda, Minnesota, in south central Minnesota, Powderhorn Lake in Minneapolis, and phosphorus reductions in the Minnesota River. Unfortunately, many of our watersheds are heading in the wrong direction. So there's much more work for us to do if we're going to live up to our reputation as a fishable, swimmable land of sky blue waters. Thanks. I'd like to introduce Commissioner Ed Ellinger, the Department of Health Commissioner.
Good morning, everyone, and thank you, John, and thank you, Governor, for declaring this Water Action Week, because water is not just an environmental issue, it is a health issue. Clean water is absolutely necessary for individual health, public health, community health, and economic health. Without clean and reliable drinking water, we would not have anything close to the quality of life that we experience in Minnesota today. You know, and people take that for granted, but a little over 100 years ago, America and other countries around the world lived in constant fear about the dangers of cholera and typhoid fever and other waterborne infections. Those diseases extracted a dramatic toll on vast numbers of people, killing many and really not allowing people to live safely. The vast improvement in our drinking water quality, accomplished through persistent efforts of evidence-based public health practices, is among the greatest public health achievements that we have. These improvements dramatically reduce disease and improve the quality and length of life. And it goes beyond just, as I said, individual and community health. It really relates to jobs and the economic development in our communities. Without a good source of clean, reliable drinking water, we would not have economic developments. These achievements are wonderful, but they're fragile. And all of us have a role in protecting our drinking water, and we need to remain vigilant in maintaining the progress that we've made over the years. The Minnesota Department of Health is really strongly committed to safeguarding the quality and the quantity of our water. As part of that commitment, the department routinely monitors all of the major public water supply systems for a broad range of contaminants. While the cholera epidemic and the typhoid fever of the past may seem remote, we still face a variety of significant challenges. As Commissioner Stein mentioned, nitrate continues to be a concern. We're concerned about that because of the blue baby syndrome, which I saw as I was a young pediatrician caring for individuals. But we've not seen cases of that because we have really addressed that through all of our drinking water systems. But we don't want that to come back, so we need to continually look for that and manage that. The challenge is particularly felt in certain parts of the state where groundwater is vulnerable due to geologic formations and some agricultural practices. Public water systems are monitored regarding nitrate and other contaminants as part of the Safe Drinking Water Act, which we're responsible for maintaining. A growing number of public water systems are concerned about increasing nitrate levels in their source water and are doing a variety of things to manage that. They're managing land use. They're taking a well out of service. They're drilling a new well. They're connecting to nearby public water systems, or they're blending high nitrate with low nitrate water. These are expensive approaches that are there. For example, Edgerton had to spend $400,000 for a new treatment system for nitrate. And then there's continuing operation and maintenance. This is very difficult for small communities where they have limited or low incomes or stable fixed incomes, particularly for seniors. And nitrates are just one of those issues. And we test that because we have a history of that, but we know where there are nitrates, there may also be other chemicals, like pesticides and industrial byproducts, or medications that we flush into the toilet. And we need to expand our efforts at identifying and maintaining those. So public and private water supplies across the state are dealing with these water quality issues. We also have other issues that are naturally occurring, like arsenic and some fecal and oral or coliform contamination. And one issue that certainly is in the news is lead. While extreme cases such as Flint, Michigan is a scenario that is thankfully rare, lead contamination is still a problem because many homeowners have houses where they have lead pipes. So we need to continually monitor that. And as Commissioner Stein said, phosphorus, which is also one of those things that are affecting our swimmable and fishable water, which are health issues. So looking ahead, to effectively protect Minnesota's health, it is critically important to sustain prevention efforts, effective treatment, and continued vigilance in monitoring contaminants in our drinking water. Recognizing these challenges and threats to their health and their economies, residents of impacted communities have made significant progress in recent years to protect their sources of drinking water. Wellhead protection, source water protection is certainly an important part of that. Also, we must maintain our focus on education and outreach to private well owners where groundwater is vulnerable to make sure that they get tested and follow up. And as Governor Dayton said, we must invest wisely in our water infrastructure. Bonding for water and wastewater infrastructure across the state is absolutely essential. The revolving loan fund to continue to help local water suppliers meet their needs. Our accomplishments in cleaning up our nation's drinking water during the 20th century are wonderful, but they are fragile. The threats continue, in some cases are actually growing. The nature of the threats facing our drinking water supplies is changing as our land use changes and our climate changes. And we can't rely on the way we've always done things. So that's why it's so important to have a year of water. It gives us a meaningful period of time in which to expand our collective understanding about what it takes to have safe drinking water and what we can do to collectively protect and improve it. So we owe it to our current Minnesotans and certainly to our future generations to continue to build on the good work of the past. And Governor Dayton's proposal does exactly that. This Water Week is a good start. The Year of Water is certainly going to allow us to continue to do what we are doing, but actually improve it and make it even better for all future generations. Thank you.
Here's my photo op. Water Action Week throughout the state of Minnesota, I hereby proclaim.